ORC 121.22G5.
So moved. Second.
All those in favor?
Aye.
Here, we will be back in about 30 minutes.
Dancing,
Welcome, everyone. We're now coming back from executive session, and we're going to have a work session to dialogue about the school reopening plan that we now, I guess, have 2 weeks worth. So, Mr. Konecki, would you like to start off with a presentation, please?
Yes, and I'd just like to remind everybody that our current board mask policy does require masks indoors for events like this, so everybody should be wearing a mask. Thank you.
Thank you, everyone.
We're going to go ahead and get started. Board members, you have a print copy of this in your folders. If you don't want to turn around, if you do, fine. You could also pull up on your computer. The last from me has this. Again, I just want to start off by reminding everybody about the assumptions we've talked about in our previous work sessions, that the district is going to continue to mitigate the likelihood of COVID spread with regular cleaning and safety protocols in place. We're going to continue to monitor and receive local, regional, state, and national data and input from area health partners and government officials to make informed decisions as we move forward as an organization. Indian Hill is only offering in-person learning at this time, and all typical annual school calendar activities are planned and have commenced since August 1st, and our teams and our performing arts students are well underway with their activities.
Mr. Konecki, could I interrupt for 1 second? One of the other board members pointed out we did not do the Pledge of Allegiance. Could we do that before we start?
Yes, sorry.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, sir.
Thank you. I apologize. When we met last, we talked about and amended the school board face covering policy. Masks are required inside all school buildings at all times. We also discussed having a chance to review and evaluate prior to September 14th, which is why we set this meeting, and then again requiring this policy in effect through September 14th, at which time we will also evaluate where we are. We know that masks can be removed for lunch and cafeteria while students and staff are eating. Masks can be removed by students already in approved school activities or events indoors related to the practice or competition times during performing arts and or physical activities, such as phys ed, choir, gym, dance, etc. We also ask all visitors to comply with the board policy on campus. And the federal transportation order, which was recently amended, requires masks for all passengers now through January of 2022. That is a change that came out since the last time that we met. We discussed the last time we met a rationale for a biweekly review period, whether it was public or not, for our mask requirements in school. And the rationale was to offer consistent opportunities for all children. We know that we don't have vaccines for children under 12 at this time. We wanted to continue to look at regional, state, Delta V caseload trends, want to receive input from our pediatric stakeholders. We also know, of course, as we're operating with our school and most of our students back on campus, that we do not have 6 feet of social distance across campus due to our facilities changes and our in-person enrollment. We've communicated that to all of our parents and families. We've also know that we can adapt and pivot our changes to plans if necessary. Some of this is review. Some of this is new. So, federal COVID vaccination rates currently just over 52% of fully vaccinated Americans ages 12 and over. As of the most recent data, I believe it was 52.3%. There was a federal benchmark that has been communicated and set to the public several times since June, and that is a 70% vaccine benchmark for all age groups. The Ohio vaccination rate is currently 64% of all Ohioans are fully vaccinated across all age groups, 12 and over. Again, there are no vaccines currently available for those under 12. Delta V caseloads have trended upwards for the 5 to 17 age group for the past 8 weeks. And Hamilton County's positivity rate right now is 8.4%, which is considered significant community spread with the information shared through local health agencies.
I have 2 questions on this slide. One is on the Delta variant caseload trending up. Do we know where it started and where it is now? So trending up, but by how much? And then the second question is on the positivity rate. Do we know of those positive cases, are people vaccinated or unvaccinated?
I'll start with your second question first. What we know is that the large majority of people being hospitalized right now are unvaccinated. And those in ICUs that are filling ICUs at all age groups, 98% of them are unvaccinated. What we know about the first question, again, is I do not know whether it's a 4-fold, 5-fold, 6-fold increase, and part of the reason I do not personally is because we're taking data that we're receiving from partners through Children's, through the Cincinnati Collaborative, through TriHealth, and through the Ohio Hospital dashboard, and quite frankly, they're not all the same. Here's some local data that matters that I think is important, and I want to start by first saying I am so grateful to our families and our students for sharing, and for our staff members and faculty for sharing information that is helping us to think about this topic. We put out a survey and we have had a tremendous response in a short period of time from staff. And if you look at our teacher vaccine data here and how it's changed, as of 8/31, we had over 81.5% of our staff respond to a quick survey this week, and of those that responded, 92.90% are fully vaccinated. Now, this is incomplete data, so as we go through some of these slides, we're going to see data that's incomplete, but this is what we know now, and we didn't know this on August 3rd. And so I really appreciate our staff sharing this data. We will continue to ask these questions at intervals, and we hope to have a more complete set of data. But what we do know is this is really good data, and this is a really good rate of vaccination among teachers. So we appreciate that. Same with our students and families. Again, I can't emphasize this enough. It's exciting to know that we put a survey out in 1 week and that in some cases over 80% or more of those families responded immediately to share this information with us. That's a celebration for this community. I've worked in schools for a long time. I've never seen response rates to surveys like this on any topic. So I really appreciate it. It's that important. And so when you look at this, we know that grade 7 students, I'd like to point out, we may never get a 100% response rate, and not all 7th graders are 12 years old. So some of them are never going to be eligible for vaccines. But when we look at the percent of respondents who are vaccinated, I think there's some things to celebrate here. And I made the 9th grade, I put it in green there just as one example. Over 80% of those respondents are fully vaccinated. That's great news. There are many, many communities around this state, school districts, dealing with far lower vaccine percentage rates than we are. And I think this is a point of celebration for our entire school community moving forward, to see these grade levels at over 70%. Now, because it's an incomplete data set, the actual percentage could be lower. And that's important to note also. That's important also. Any questions about this slide before I move on? We're going to continue to ask families to share, and we're going to continue to hope that our response percentage goes up, because I think this will help all of us to dialogue about how to move forward. We're also going to continue to let people know about vaccination clinic opportunities so that people can make an informed decision on their own. Here's some other information, again, with our students. Sorry, I'm showing you the same picture here. Our IH case data, number of positive COVID cases per building. Again, we've been in school now for 9 full school days. We've had 2 cases that we reported last week, and across 2 different buildings. Quarantine data, again, we're looking overall here. We had 7 students and 1 staff member, a total of 8 over the last week. So one of the things we've talked about, board members, is a decision framework moving forward. We've heard lots of people asking you all and us lots of questions about how do you go about making decisions. We talked about a rationale for this process of looking at decision matrices and a framework, and for several reasons. The rationale, of course, would be it provides a process for dialogues around complex issues, allows us to focus on some values and data that matter to make decisions, allows for regular transparency in our process to the public, outlines possible solutions or targets, defines a starting point and a conclusion to complex discussions, and communicates the decision process to all of our stakeholders. We make some assumptions about decision frameworks as we talk about these as well. First, that decisions could be made by the board multiple times, and they could change. Data could be reviewed weekly, which is something I think we've all committed to, looking at reports every week and to do public reviews at intervals. To be nimble. And I think going back to the start of the pandemic, we talked about our administrative team has to be able to be nimble and adapt to changing environments. Visual representation in the decision framework can help everybody understand how you evaluate something, and possible solutions or targets can be adapted over time. And of course, these things define success. So one of the ideas that we share today, and again, this is just for dialogue, this is not something that's a formal recommendation or a decision that has to be made, but a way to think about moving forward. And when you look at this, we all believe that quarantine percentages and caseload percentages, we have a lot of data on this from the last couple of years, and we're getting more and more information now about vaccine percentages. So I'm gonna actually work from right to left here for a moment. We learned last year that even at our worst, we never had more than 2% of our building populations dealing with COVID cases, positive cases. And so what we chose here as a current factor for evaluation is that less than 1% is good. Over 1% is concerning, because we know what happens when we go into the 2, 3, 4% range. Concern grows. And when you look at the column on quarantining, we know that last year, during our worst week at the beginning of December, before we had to make a shift in plans, that we were well over 7% when it came to quarantine. And we had a lot of trouble staffing our district to operate in person at that time. And there were a large number of staff and students who were quarantined. So again, we backed off of that number that we knew was very serious and arrived at a 5% rate of concern. Less than 5%, we feel that our students and staff will be able to operate on campus without problems, major problems. Over 5%, we become concerned. When we move to the left to talk about vaccine percentages, again, we know currently that one of our factors is we have an incomplete data set here, and that less than 75% of our student population is fully vaccinated. And so what we need to dialogue about in the future is, what is a good target? And as this data becomes more complete, what could we tolerate in order to get that goal met in the green that would make people feel comfortable? And of course, when you look at this decision matrix, all three of these columns are linked. If you look at the language below, if all three benchmarks were met, we would want to dialogue about whether that language should be something that would make us feel confident about going mask optional or providing exemptions to vaccinated students in grades 7 through 12. If two of the three benchmarks were met, would we feel comfortable exempting students who are vaccinated or providing or sticking with mask required? And again, these are things that the board could determine. And we felt that if one of the three benchmarks were met, we couldn't move forward. In some cases, if two of the three aren't met, we're not sure if we can move forward, and that's something we'll need to dialogue about. We do know that staffing ability and unique events could impact this, and we know that we could update this dashboard for the public so that we could share data weekly moving forward, with the understanding that the vaccine percentage column is not 100% accurate because we don't have 100% responding. Yes?
Question, the quarantine percentage, you say right now we're greater than 5%?
No, what we're saying is that would be the threshold that where we would feel uncomfortable moving forward. Dr. Hooker, just to clarify, that's not where we are now. That is the factor that we would use to evaluate whether we were in yellow or green.
And how many children are in 7 to 12? total kids being educated in the 7th through 12th?
Over 1,000.
So we're saying that we're willing to tolerate 50 kids in quarantine, not in school, not learning?
Well, on our worst week last December, we tolerated over 128.
Yeah, but we didn't take the mask off.
Correct.
Okay.
We also did not have anybody vaccinated.
Right.
So good questions, and again, we're trying to, look at what would that threshold be if it was green, less than 5%, would that be comfortable? If it's more than 5% and you're uncomfortable, we could adjust those numbers. Other questions about this particular slide before we move on? So the next layer of this is governing body factors. We've heard, again, language. This slide is more about the language that would make the board comfortable. So anything in green would be the policy goal, which would be more flexible than what we currently are hearing from governing bodies. So the current language that we're hearing from the CDC, from ODH, from Hamilton County Public Health are recommendations, strong recommendations for masking indoors. None of those are requirements. That's the current language. So our thinking again is anything in green in the future is a goal for policy language that is less restrictive. It is more flexible. And if those benchmarks were met and the board felt that that language made them more confident, then again we could look at 3 of 3 benchmarks, mask optional, 2 of 3 benchmarks, possibly mask exempt options for those in grades 7 through 12 with a vaccination proof, and 1 of 3, we would stay where we are. Those could all be adjusted. We could talk about whether we like 1 of 3, 2 of 3, 3 of 3, but that was our thinking. And that's the current language versus what we would call a goal for the future. Everything that's a goal is in green. Next would be association factors. Again, these are things we hear from partners and local health collaboratives, and again, associations that put out information regarding this. So these are just examples. Again, current factors and current recommendations from all of the groups you see here, whether it's our Tri-Health Partnership, the Cincy Collaborative, or AAP, are recommendations for masking indoors. Tri-Health, for example, their doctor group and their association has talked about the fact that if we were locally under 3 per 1,000 case rate within our zip code, that would be something that they would feel confident about and a less restrictive environment than what they're recommending right now. The Cincinnati Health Collaborative, when we meet and we talk during the week, we talk a lot about the R rate, and obviously anything that's less than 1 is better. When it's over 1, that's not as good. So right now, for example, it might be 1.39 in this county. That's not as good as 1.0. That would be an example if you liked that data value that they share. And of course, AAP, they would take a language recommendation approach where they would soften their language, and we believe, just like last spring, for them to change their recommendation from masking indoors to something less, it would be tied to vaccine rates, and then it would soften. Their language and their recommendation would soften that based on vaccinations, you might be exempt from wearing a mask indoors in the future. That's why we put that as the goal policy. When we see that language, we'll know that they're being more flexible and they're changing their recommendation. So again, you could decide which of these benchmarks you like, how many of them would trigger a response or a decision. All 3 slides we just showed you could be linked, or you could prioritize and rank order them. We put them into a priority order, starting with local data, then governing body language, then partnership affiliation language. That's the order I just went through, and I think it's important for the board to just discuss and decide how you would like to prioritize that. Questions about any of those?
Not really a question, but I want to point out when we're talking about the values and what we're comfortable with. When we talk about the 5%, you said the number of 50 kids, if we have roughly 80% of our kids vaccinated, you can take those 80% out of the equation because they will never be quarantined unless they're sick.
Under the current ODH guidelines and the language again that was clarified today, if you are vaccinated, you would not have to quarantine.
Correct. So we're talking then about roughly 200 kids and the percentage against that 200. So I think
Talking
that's a
about smaller.
major distinction.
Yeah, and I think that's important moving forward for us when we're reviewing data that we could look at, again, over time. We could start to look at the population differently. And again, these grids could be replicated for K through 6. The reason we're not showing those today is because we know there's no vaccine approval right now. But again, we could duplicate these for K through 6. Other questions or
Just one other
concerns or
question,
comments?
to Nancy's point. If we did this, we would have to know how many people were vaccinated. In order to come up with an accurate number, you'd have to know how
Well,
many were
I
vaccinated.
think we can get a very close idea. It looks like, you know, from one week to the next, we got a much higher rate of survey participation. I mean, we'll never know for sure.
If we don't get to 100%, right, that would be a concern that you would never have a complete data set from all of our surveyed population. The closer we can get to that 100% response
I'm not looking
rate,
for
the better.
100%, but I don't think 80% is going to be good enough. But yes, I
No,
agree.
but after sending it out one time and getting 80%
Yeah.
response, I think that's, you know, and if people understand that the more information we have, the better we can make a decision, I think people will participate. I think the participation rate in the survey was excellent.
And we will send it out again, and I think, again, I just want to emphasize how proud I am of our students and families for sharing this information. And I know from the data we have looked at from school districts all across Ohio, there are over 600 of them, we have a high vaccine rate of the respondents that have shared this information with us. We are in really good shape compared to a lot of other areas of Ohio right now, and we should be proud of that, and that gives us a starting point for this dialogue to set some goals for the future. Other comments or questions or concerns about these?
Well, I think, Eddie, to Nancy's point, that's why we're talking about percentage and not number of kids, because that will change. And based on the student data we have here, the minimum number of kids that are vaccinated, because not 100% have responded, you are looking at close to 80%.
So when we met last time, we talked about what were the evaluation factors that mattered to the board. And again, this is just a little bit of a review. What we tried to capture in those last 3 slides were these factors, and to focus in on how they could be used, knowing that we're going to continue to look weekly at local zip code case trends. We have asked the Ohio Department of Health with many partner schools to break out that data demographically for us, so that not only can we see caseloads by age, we can see them, we can see vaccine rates by age, by zip code. And ODH has still not put that data out because they're doing what they call a HIPAA review. But we've been asking, we're going to continue to ask, and we're going to continue to pull whatever data we can from our partners. We'll look at these throughout the week. We'll look at the hospitalizations. We'll look at the county positivity. We've done all of that, and then we've included the rest of these 3 slides that we just shared with you. We think these are a good way for the board to look at either some independent or linked decision matrices to make decisions moving forward.
Another thing to point out is if the federal percentage of vaccinations that the federal government is pushing for is 70%, then, I mean, I think that's a great starting point for us. I mean, I think in our district, we can expect to see more. But if the government and the federal government is saying 70%, there's no reason for us to feel that we have to have 100% or even 90%. So just that, I think we just need to keep that perspective.
Yeah.
I mean, the more the better, obviously.
70% is the communicated federal benchmark for all age groups over 12 to remove restrictions that were in place. That was what was communicated throughout the spring and summer months.
Has that changed recently?
Not to my knowledge. It was restated again last week. I think that the federal government restates it at intervals. And again, we're not there nationally, right? The number is lower than that nationally, but in Ohio, we're at 64% for the state. and this county mirrors the state in many ways, overall vaccine rates, but our student population that we know with respondents is already higher.
The only thing I don't see on here, and maybe I think we would take it into account, is what are our, what are the recommendations of our trusted scientific advisors, Tri-Health and AAP and CDC. I would think that would be part of it. How much, I'm not trying to make it be a certain number, but I think that ought to be on the list, and when we're looking at this in 2 weeks, we should have all that data and see if anything has changed. So I would think that would be part of it.
Yeah, and Tri-Health's best advice to us right now, if we were looking at how to assess moving forward with masking indoors, because right now they're recommending universal masking indoors. Our partner association would be to look at when the cases per 1,000 in our zip code come down to 3 or less per 1,000, that would be a good sign. And then they believe that their language would change. With regards to the health collaborative, there are several pieces of data they look at. Our rate is how they start with us every week on our meetings. We could pick a different value. I could share a little bit more about that with you, but again, these are the things that they're communicating to us in general.
No, I was just saying, I think it'd be nice to have
Yeah,
that, that what is, it could change any day, but
Sure.
I would always want that as part of the information.
And what's the caseload in our zip code right now?
We don't know by age group, under 19, they don't break it out demographically.
Just
And
overall,
there is
yeah.
a discrepancy here that I think we've heard from people who have shared information with us. This is not a judgment against anybody who shared information, but if you look at the Ohio Hospital's dashboard for COVID and the 0 to 17-year-old cases that they report and hospital admissions they report, their number on their dashboard, which you can look at day by day, is not the same as what our own collaborative or what Children's report. And so it creates confusion for people, including me. And I'm not a doctor, right? So just want to keep that in mind as we move forward.
Kim asked that when everyone speaks, if they move closer to the mic because she's having a difficult time hearing and she's concerned that others who are listening might have the same problem.
Thank you. So just to review again, do you have any other questions about those slides and the evaluation factors before we move on, board members?
I have just one. Can you define locally?
Well, what we've said for the last year and a half is local would be local campus cases. And when we were looking at caseloads last year, board members often wanted to know what the contiguous district case numbers were in our zip code. That's as good a definition as I could review. If that is still how you want to talk about local, I think that's what we've always done.
I think it's, her point is good. We need to know the local data for 45243 if available, but then we have to have the city and the county and the state data, have all of that available. I want to see it all, and then we can weight it whatever way we want, but I agree with Elizabeth. If available, I'd love to see, what we have in our district. We know what our kids are because we have all our kids, not all of them, but most of them.
And we continue to share weekly local campus, local zip code data, state data, regional data, and national data.
Yeah, I think that will be very helpful when we are revisiting it, because that gives us more idea about not just what's happening in a district, but around.
So again,
in
just to go
Cincinnati.
back to these 3 framework slides, all those layers are within those 3 slides. They're just shown visually in a different way.
Okay.
Okay, so other comments, or should we move on? Masking protocols, again, just a reminder, we went over all this before. I'm not going to read through all these slides again. The big change here is bus transportation. They changed the federal order through January 2022 now. That's part of a federal law, so or has language that has the effect of a law at the federal level. So all bus transportation, that's masks during the school day, to and from school, going to activities, for everyone. When masks are not required, again, we reiterated this. We've had several people say, how come we see you wearing a mask, you know, indoors but not outdoors? Our policy is focused on indoor mask wearing. We've had people ask, how come people who are in the gym aren't wearing masks during the school day? If they're in a physical education class, they may not be wearing masks while they're participating. When they're not extending themselves physically, they should be wearing a mask. We have had great success in the first 2 weeks of the school year. I'm very proud of our students and staff for modeling this. I think they've done a great job.
Kirk, I think the board has heard this, but people are listening to the meeting. I think you told us that told me at least, that the physical education teachers are doing a really good job of trying to maintain distancing in the physical education areas, as well as the music teachers that, you know, even though they have the mask off, they're doing a lot.
Yeah, our specials teachers, our performing arts, music department teachers, our physical education health teachers, going back for 1.5 years now, they've modified lessons and activities. When people are static and not moving, they're keeping them physically distanced. When they're involved in their actual activity, they're allowed to do their activity and remove a mask. And that's what our teachers have done, and I think that the students in those classes have done a great job. Contact tracing, just to give people a couple of updates. We did receive new language from ODH today, and we've also continued to track our weekly quarantine data, which we showed earlier. We are going to put on another mobile vaccine clinic that'll be offered on September 9th at the Tennis Pavilion parking lot from 10 to 1. Again, that is in partnership with Hamilton County Public Health. Anybody is able to participate. We did have questions about whether students were allowed to participate with or without their parents. Every student who goes to one of these clinics gets a parent permission form and waiver signed. Most of them are accompanied by their parent unless they're over 17 years of age. We did give vaccines out at our 2 prior clinics to 20 individuals who came from the community. So thank you. And we will offer another of those. And again, it's up to anybody who chooses to participate in those. We're going to continue to offer those opportunities. Exemptions.
Are they the Pfizer vaccine?
Pfizer is what is approved, yeah. Students and staff, again, are exempt from quarantine, and we got some clarifying language again from ODH on this today. But basically, if you're vaccinated or you're wearing a mask, you will be exempted from quarantine, where you have 3 feet of physical distance at all times. There's a slight change in the new ODH language with regards to the duration that you may be around someone. But again, the keys are, if you're wearing a mask, you're going to be exempt. And if you are vaccinated, you're going to be exempt. I just want to reiterate, we have a lot of resources available for students and families who are concerned, and all of our partners. And we've had questions about how to contact our partners. Students and families can contact principals. They can contact school counselors. We can put them in touch with our school psychologists. We can get them referrals to these resources. They can talk to our Director of Pupil Services, Erica Leppert. We have people here to help if somebody is looking for help. We talked about future considerations. Some of you have seen in the news that, again, Pfizer was formally approved now by the FDA as of 8/25. Also, booster shots have been recommended for adults 16 and over beginning September 20th. Those will be available. There is research and some, conjecture out there in the community about who needs to get a booster shot and when, but they will be available September 20th. And again, we will share that information with our staff so that they have awareness of that. There is state legislation pending. There are 3 bills that will be talked about in September when the legislature comes back into session. Many of them are getting back to work now, informally and formally next week after the holiday. Our communication will continue to be routine. We're going to ask students and staff who are ill to stay home. I'd like to repeat that. If someone is feeling ill, they should stay home. We're going to continue to use Pickup Patrol. We've been using it successfully since the start of school, and it really helps our administrative team to gather a lot of information and to help people feel confident about coming to school every day. We're going to continue to share this weekly data with the board. We're going to continue to review our health partnerships and talk to Hamilton County every week for evolving news. We've done this now for almost 2 years straight. We're going to continue to report our cases, and we're going to continue to provide vaccine information for children and staff as new opportunities become available. And those are all things that we try to do consistently. We do have to report cases. We've gotten questions about this several times. We have to report cases. It is a standing order which has the effect of a law from Hamilton County Health and ODH. And again, there was a graphic we shared before about quarantine and how that all works. I think people have seen that. They can access this on our website. Board members, did you have any questions or comments or concerns about the presentation before we dialogue?
Are you communicating to parents that if they keep their children home, they will be not penalized for absences due to illness?
Yes, anybody who is staying home, again, our teachers are working with them. That has the same effect as an excused absence, and staff. This is a really tough thing, right, for people who are used to coming to work every day and school every day. That kind of changed with this pandemic a year and a half ago. We need people who don't feel well to stay home.
So I have one quick question is, so kids who are going into quarantine or has been tested positive, how are we helping them educate since we don't have Brace Virtual Academy? Are our teachers working with them?
Dr. Stewart, I'm going to let you handle that while I drink some water, if that's okay.
So interestingly enough, last year, when we started to see a rise in the students who were quarantined, it was nearly impossible for us to meet the needs of all of those students within Brave Virtual Academy. So it really fell to our classroom teachers to be the one to make contact and to help those students when they were at home. We received mixed reviews from families about how that went during quarantine. So we are currently working on a plan that will be a better definition of the expectation that we'd like to make very public to everybody. What can they expect to see happen during a quarantine? One of the difficulties we'll have right away is that we will probably have less students at the high school level who will have to be quarantined because they have the vaccine. Students who are quarantined at the high school level, though they need contact from their teachers, can be at home and for the most part be very independent. That reverses when we're talking about students at the primary and elementary who do not have the vaccination available to them, and when they're at home and they're quarantined, they really do need adult assistance in order to access the curriculum. So that's kind of the problem that we have, and we're in the middle of working on that right now so that we can be very clear with everybody about how we're going to try to take care of our students who are quarantined.
Thank you. Can I also ask you one more question? Since school just started, how are our kids doing?
She's smiling.
I am smiling. Seeing our students in school every day is not anything that I will ever take for granted again my entire life. Having students in school is where students need to be.
Very well said. All right, board members, thoughts?
I can go first if that's fine. So I think you said it perfectly, that students needs to be in school, and that's what I think we all are aiming for, and that's the best place for them to be educated, and for their mental and social health it is important that they are in school. So a few things that I looked into, that I would like to share with everybody. Some facts that we already know about is, like as Mr. Kennedy said, that we don't have the vaccine for younger ones, that we know. Second was the wearing mask based on Ohio Department of Health, says masks have been proven to be extremely effective in slowing the spread of the virus, which Ohio researchers conducted on the evaluation last year that shows that masking helps control the spread of the virus in Ohio schools. So that's to know that, masks are important and they will help us. We have seen that Delta variant is affecting younger kids now, and the number of kids hospitalized with COVID in United States recently hit record high based on all the data that we have seen through CNBC reports. The other thing is the Delta variant caseloads have trended up for about 5 to 17 age group in past 6 weeks, which is important to consider. Our local pediatrics ICU is close to capacity and seeing a hospitalization at a rate they haven't seen since the winter surge that has happened. That is something very important to be remembered. And our neighboring counties, including our own, meet the CDC definition of high transmission right now. Positive cases in kids have doubled since last 2 weeks based on Cincinnati Children's. Hamilton County positive rate is 8.4, which means a significant community spread. Our buildings, as we all know, are working in a full capacity, and we cannot offer 6 feet distancing, and sometimes 3 feet becomes an issue too. So that is something to be considered. And the number of new COVID-19 cases in Ohio hit their highest level in the 7-month last Thursday, which is alarming for me. We all know that vaccine is the best way to control the virus, and I'm very proud to say that our teachers are 92% vaccinated, which is just amazing. Bravo to all our teachers. And I can see that our students' vaccination rate is going up, and hopefully soon we'll see most of them vaccinated, which will help us tremendously evaluate the situation when we are doing it in future. Now, these were some of the facts that we all know about. Now let's move on to things we know based on the scientific studies and what we have experienced together as an Indian Hill Brave Nation during this pandemic since it started. For kids, in-person learning, we all know, is the most effective way of learning. For kids' social, emotional, and mental health, it is important that they are in school with the teachers and their friends. Last year, we saw that when students were put into isolation during quarantine due to exposure, or when school went remote due to large number of students, staff being in quarantine, affected badly on their mental health. We know mental health is an issue that we all are aware of. It is where it was there before pandemic started. It is still there, maybe a little bit more, due to so much of uncertainty and things happening around us. And I think being in pandemic is not easy for anyone, especially for kids, as it creates many kinds of stress and anxiety for them, like isolation, not being able to see their friends, hearing people getting sick around them, academics, athletics, and other social pressure that they go through. It is very important that they are in school so that we can handle some of these problems. Honestly, I think our students have done a great job wearing a mask before, and they're proudly wearing it again without complaining. As they understand, not everyone around them is eligible for vaccine, as we know. So in my opinion, to prevent a bigger problem, or for our students better mental health, social health, and better performances in everything they do, it is very important to keep students in school in person 5 days, as well as we all know, students benefit from in-person learning. Some of our experts that we had all been looking for the advice for, as we are not an expert, I just looked into what are they recommending. Our health partner, TriHealth, is recommending masking indoor. American Physician of Pediatrics is recommending masking indoor. Ohio Department of Health is recommending masking indoor. Cincinnati Children is recommending masking indoor. Center of Disease Control is recommending masking indoor. Our local practicing pediatrician, where we take our kids when they are sick, are recommending that kids should wear mask indoor because of high number of cases that they are seeing and more kids going with symptoms of COVID. I think because we are all doing our job of wearing a mask, we are able to keep our numbers low. In comparison to some of the other local schools, like Mason, has 6 times more cases. Deer Park has 10 times more cases if adjusting for student population. And to remember, these schools had mask option policy. Our kids are doing well, our numbers are low. I think masks are working. One thing I just want to take this opportunity to say something to our Braves. Braves, you are doing a great job wearing the mask and protecting each other. I know it's not easy, but I'm proud that you all understand it's important for a brave nation. So, good job, Braves, wearing it. For future, I love, Mr. Kennedy, your suggestions. With all these, I would also like to see what's happening in the city, the numbers in the children's, because they see a lot of our students there. So I would love to see those numbers too.
Thank you very much. Nancy, would you like to go?
Yeah, just a couple comments. One, I think we need to be careful when we're throwing stats around. My understanding that a lot of the cases of children in the ICU at Children's are due to RSV, because there seems to be somewhat of an epidemic of RSV. So just, we need to be clear on our facts.
Nancy, that is absolutely true. Most of the kids are RSV, but there are kids with COVID also.
Yes,
You're absolutely right. There is a horrible RSV epidemic.
But it is a myth that our ICU at Children's is full of kids with COVID. It's not. It's RSV. And
Yes.
some of that
It is a combination of it, what they are seeing.
Some of that is because they were not getting it last season because of all the masking. I also want to be careful about I think we need to listen to all of the input from all the agencies, but all of the ones you quoted are not regulatory agencies. The regulatory agencies, Hamilton County Health Department, is not requiring masks. They're working the quarantine around the mask, but they're not coming out and requiring it. So just
They are
keep that
strongly
in mind.
recommending that students
me.
wear a mask.
I didn't interrupt when you were talking.
Yeah, I'm just clarifying that what you just said.
Let's let Nancy talk. I'm sorry, I was trying to help you, but I think I interrupted you too. So
did.
let's let you talk.
So first of all, I really appreciate this work that you all did. It's really helpful to start having some kind of a framework that we can work from, make decisions from, and that our parents, our families, our children can start to understand what to watch for. I think it's super important, and I think it's critical that this board come to some agreements about what those numbers are and how we'll use them and when the decisions will be made. I think we have to do that as a group. One thing I would like to propose is looking at this exemption from quarantine. Basically, if I'm understanding this all correctly, if you are vaccinated, you will not be quarantined. So if we have a pretty high percentage of our high school students vaccinated, why can't we, as a district, do what the rest of the community is doing, the greater community, not schools, and go with, if you are not vaccinated, you are required to wear a mask. If you are vaccinated, you may choose not to wear one. So I think that's something we need to consider. And then lastly, I just want to be sure that we leave here tonight with some type of agreement, next steps to getting this chart and the lineup of how we'll prioritize this information. Because everyone wants to know what's going on and what to expect. So I think we just need to be sure that as a group we work this out so that people know what to expect.
Thank you very much. Ms. Johnston?
Thank you. I think Nancy and Kim, you've pretty much covered everything. And I agree with you, Nancy, we need to work out a matrix so that it's understood by all the parents and they know what to expect. And you did make a very good point regarding the masking for kids who are already vaccinated. It does bring up a different perspective on what we've been talking about. But to me, the most important thing is looking at local data, because that is what impacts us. It's nice to know what's going on in the city without doubt, but we made decisions last year based on our local school population and our direct community, as well as our contiguous school districts like Madeira and Marymount and Sycamore. And those are the data we collect from that is a lot more relevant to us than what's happening in Lebanon or Mason or Louisiana or somewhere else that doesn't directly affect us. And I think that's the most important thing, is to keep in mind what's affecting us and what's best for our students. And there's no doubt the most important thing is to keep our kids in school and healthy, but we have to consider their mental health as well as their physical health. And we want them to make progress academically, and we have to consider all the factors that go into that big picture. Thank you.
Thank you very much. Again, I think thank Mr. Konecki for producing all of that information, and I think we certainly need to look at all of that on the 14th of September. Masks work. We are doing great because they work, and I'm very happy about that. I'm very happy how few quarantines we've had, and we've kept our kids in school. Super excited about that. Kids belong in school, no question about it. I would just say that the vaccination requirement or the mask requirement for vaccinated people, the CDC, American Academy of Pediatrics, both are saying that we should wear a mask whether you're vaccinated or not. So I do think we need to look at all of these things. I don't think that I can come up with a matrix of this and this and this will absolutely, the second that happens, we're pulling the mask off every kid. I just can't, because we need to look at everything. We need to meet as a board. We need to discuss it. And so I'm all for collecting all this data, and I agree with you, Elizabeth. I really want to see the local data, because you are not incorrect. Last year we made a decision that kind of went against Hamilton County and opened these schools with kids in masks, notably, but we went against the local, we said, this is what we think, and we were following the American Academy of Pediatrics, and we were against the CDC. So I don't want to say that if the CDC says, that's the end of the discussion. I don't want to say if AAP says. I don't want to say if local data shows. I think we need to see the whole thing, have a discussion, bring it forward, respectfully look at everything, and then come up with a decision on September 14th. Because I want to look at everything, and I want to compliment the district administrators who've done an amazing job of getting us information and need to continue to do so. Nancy, I just want to make sure that there wasn't anything you wanted to propose or anything. I don't want to, is there anything that anybody wants to propose tonight for a vote?
I guess,
Anything?
what are other people's opinions of the situation at the high school? Because we do have so many students that are vaccinated, and is there wiggle room for at least the high school at this point? Would you all be willing to even have that discussion?
Sure. Can I say something about the vaccination? Nancy, as you said, that if you're vaccinated, you don't have to wear a mask. I agree. In regular situations, yes, you do. They should have an exemption. But right now, we are seeing a surge in the city, like at Children's, at other places, that we are seeing the numbers going up. So I don't think it is a good idea to take that risk of, even if they are vaccinated, still they are getting infected. They may not be getting hospitalized, but those kids can carry it and pass it on. We still have a lot of kids who are not vaccinated. So if we take the mask out right now when we are in the surge, we might see more number of kids getting infected.
Well, we might, but the number of positive cases per school building have been extremely low, and children are going to be exposed outside of the school building because as soon as they leave the building, the masks are off. In all their activities, their masks are off. They're not doing anything, depending on the child, they're not doing a lot of other activities without masks. The exposure is coming from outside the school. So, and at this point, even with all that, we have virtually no cases. So I don't think taking, national data or even regional that is so much different from our neighborhood can be applied to this particular situation. And at some point, we need to be able to have a sliding scale of what we'll tolerate. And I think that's what we really need to work on getting to.
Nancy, I like what you're saying. We're dialoguing on this. Right now, I'm not at that point, but I might be September 14th. I'd have to look and see where things are because I think that it is something that we need to see what the recommendations are and what the local data. But I hear what you're saying.
But what difference does another 2 weeks make?
2 more weeks with mask on, 2 more weeks of protection. It's the way I'm looking at it.
Yeah, it has been just 9 days since we had full school days. Like we had only 9 full school days, and I think it's too early to act on it. And I think by September 14th we'll have more data, and we can evaluate then.
But I certainly would be willing to consider that.
Yeah.
That is not off the table by any means, that, either a graded thing, because some of the school districts that are not doing horribly have had a split where they said pre-K through 7 or pre-K through 6, depending on the school district. So I am absolutely willing to have that discussion as a board.
Yeah, me too.
And notably, a district right around the corner from us who has optional 7 to 12 has like the lowest caseload, lowest quarantines around. So it's really hard to say that there's a direct correlation between optional and required, and in situations where the community doesn't have a caseload.
I totally agree. I think we need to look at the data. I wish we could have a good scientific study on it, but I don't think we're going to have that. So I do think that we ought to ask as best we can to have someone look at that and get all that data for us to look at. You're not wrong. Unless there is other comments from the board, I would like to entertain a motion to modify the agenda to allow for public commentary since we did not have it on the agenda.
So moved.
Second.
Oh, do we need a roll call, Mr. Davis?
We do.
Did I hear earlier you had an executive meeting that wasn't announced in the notice?
It's in the notice, sir. Do you need a roll call, sir?
Did you do a roll call vote for it and explain why you went to executive meeting to us?
Sir, no, I can't. Please be seated.
It's on the agenda.
Sir, I'm not really willing to have a discussion with you. Please sit down. I heard what you said.
Mrs. Eichholz?
Aye.
Mrs. Singh?
Aye.
Mrs. Johnston? Dr. Hooker?
Aye. Believe we've had how many people sign up for public commentary, sir?
7.
Okay. If those people, if you could call them down and you do the timing, that would be awesome.
Certainly. We will do this similar to the way we've done it in the past. I will call the first 4 people down. The first person will be the speaker. The next 3 will be on deck to speak. As that person finishes, I'll call the next person down to get in line. I will do the timing. There will be 5 minutes per person. And that order will be Joan Garrett, Katie Foster, Jennifer Creedon-Harris, and Jeffrey Heineken.
And if you don't mind, state your name and where you live.
Yeah, my name is Joan Garrett. I live in Sycamore Township. So by way of introduction, I'm a PhD scientist focused on identifying and overcoming mechanisms of resistance to targeted cancer therapies. I also teach pharmacy students. But I'm here now as a mother to 3 children enrolled in the Indian Hill schools. Their ages are 11, 8, and 6. None of my children are eligible to receive the COVID-19 vaccine. So I'm asking you today to revise the mask mandate to include all indoor activities, including gym and music class, and furthermore extend the mask mandate indoors until all school children are able to be fully vaccinated against COVID-19. My 6-year-old son Henry started kindergarten at the primary school this month. Henry has a rare disease, a congenital myopathy. So congenital means you're born with it. Myopathy is muscle weakness, so this means he was born with a muscle weakness. The genetic causes of Henry's disease remain undetermined, and I've emailed you all separately this morning and sent you a link to his Undiagnosed Diseases Network website so you can see more information about that. Henry has a history of recurrent pneumonia and respiratory failure. As an 8-month-old, a rhinovirus infection, common cold, caused Henry to be intubated on a ventilator for 6 days. He spent 8 days in the ICU, and he was hospitalized for a total of 13 days. Henry has been hospitalized more than a dozen times for pneumonia throughout his life. His medical bills have been over $1 million. Our $1 million baby is a joy. He loves to be a ninja, he loves to wrestle with his siblings, and he always does a funny and sassy comeback for his parents. Henry has had an individual education plan, also known as an IEP, since he turned 3, when he became eligible for an IEP. Henry has made steady progress, and it's essential that Henry be integrated with typically developing peers for his growth, and also per the Individuals with Disabilities Education Act. So the acronym for this is the IDEA. So Individuals with Disabilities Education Act. This stipulates that children with disabilities should be educated in the least restrictive environment. So the acronym for this is LRE, least restrictive environment. So for Henry, the LRE means he should be integrated with his typically developing peers and not excluded from indoor music and gym because students are not wearing masks. As it currently stands within the school district, Henry cannot attend this curriculum because students are not wearing masks. The risk is too great for Henry to be in a room full of children without masks. No one knows or could predict how Henry would handle a COVID-19 infection. Given Henry's medical history, it is essential to limit his exposure by wearing masks until everyone in the room be wearing masks until Henry can be fully vaccinated against COVID-19. So in summary, given the increasing numbers of COVID-19 cases and hospitalizations in children, I implore you to revise the mask mandate to include all indoor activities, including music and gym class, and furthermore extend the mask mandate until all school-age children can be fully vaccinated against COVID-19. So thank you for your time and service to our children. So I know I have about a minute left because I'm also timing it. And so I wanted to read this. So I didn't write this. This is by Tracy Walker with contribution by Tiffany Banks from the Center for Dignity in Healthcare for People with Disabilities. Schools that do not require masking fail to meet the needs of children with disabilities. Based on the rise of the Delta variant of COVID-19 and the increasing number of breakthrough infections, the Center for Disease Control and Prevention, CDC, revised masking guidance on July 27, 2021. The CDC continues to recommend that people ages 2 and older and those who are not fully vaccinated should wear a mask in indoor public places. In addition, the CDC guidance recommends that fully vaccinated people should wear a mask indoors in public areas, in areas of substantial or high transmission. So I'm going to stop there. I think that the next few speakers are also going to read from the same thing. So thank you very much. I appreciate your time.
Thank you very much. You're very good at timing that.
If you have comments that you want directly put into the minutes, if you could leave those with Mr. Nichols, I would appreciate it. Thank you. The next person up in line would be Amanda Holbrook. And Katie Foster, you're up to speak.
Yeah, that confuses all of us. So again, state your full name and where you live, please.
I'm Katie Foster. I live at 9901 Aldar Court in Sims Township. I am the mother of a medically complex kindergartner here in the district. And I agree with what the board has said. All children should be in school. And the best way you can do that is by extending this policy to change it so that masking is also required in gym and music, because right now all children are not able to participate in school. All right. So unfortunately, the district's current mask policy is in violation of my son's civil rights and the civil rights of other students in the district that fall under the protections of a 504 and IEP. To eliminate this policy altogether would be a further violation of his and his peers' rights. I'd like to read part of a statement authored by Tracy Waller with contribution by Tiffany Banks, outlining these violations and why they're problematic. In the U.S., the Pfizer vaccine is the only COVID-19 vaccine available to people ages 12 and under. On August 23rd, 2021, the Pfizer vaccine received full U.S. Food and Drug Administration approval for protection against COVID-19 in people ages 16 and older. But as the summer winds down and children return to school, those under 12 are not eligible for any of the COVID-19 vaccines. On July 18th, 2021, the American Academy of Pediatrics issued its COVID-19 guidance for safe schools, urging in-person learning because remote learning highlighted inequities in education, was detrimental to the educational attainment of students of all ages, and exacerbated the mental health crisis among children and adolescents. In its guidance, the AAP recommends universal masking in schools for several reasons, including that a significant portion of the student population is not eligible for vaccination, and to protect unvaccinated students from COVID-19 to reduce transmission. On August 5th, 2021, the CDC issued guidance recommending universal indoor masking by all students ages 2 and older, staff, teachers, and visitors to K through 12 schools, regardless of vaccination status. To protect the protection of masks is higher when worn by a virus spreader, highlighting the importance of universal masking. Schools and masking. Studies have indicated a reduction of COVID-19 transmission with universal masking in schools. Despite mounting evidence in the CDC and AAP recommendations for universal masking in schools, the topic of masking in schools continues to be a polarizing one for parents and policymakers. According to Education Week, August 19th, 8 states had prohibited school districts from setting mask requirements. 14 states and the District of Columbia require masks be worn in schools. Across the country, some school districts have chosen to move forward with mask mandates while others have not. That leaves many students at high risk for contracting COVID-19. Children under 12 and children who are immune compromised are especially vulnerable. The American with Disabilities Act, under the ADA, public entity shall make reasonable modifications in policies, practices, or procedures when the modifications are necessary to avoid discrimination on the basis of disability, unless the public entity can demonstrate that making modifications would fundamentally alter the nature of the service, program, or activity. Because last year there was masking, universal masking in all areas, it is not considered a fundamental change. A mask mandate is a reasonable accommodation that does not fundamentally alter any school district's ability to provide services, facilities, privileges, advantages, programs, or activities to educate children in school. Because many children under age 12 are in school, and the Delta variant has created breakthrough infections, increasing pediatric hospitalizations, universal masking not only accommodates children with disabilities and their family members, but also protects all children in school. There are no studies to support that masking traumatizes children. The Individuals with Disabilities Education Act and Section 504 of the Rehabilitation Act. School districts across the country educate children eligible for Individuals with Disabilities Education Act, IDEA, and Section 504 services, children with underlying medical conditions. In the 2019-2020 school year, 14...
Time is up.
Okay.
Thank you very much.
Appreciate it.
Megan Seaman Kosmeyer, could you please come and get in line?
And please state your name and where you live, please.
My name's Jennifer Creedon, and I live in the Sturbridge subdivision, class of '89. 4 kids in the district. I spoke a couple of weeks ago. None of my children are medically complex. However, as I mentioned previously, my 12-year-old has long COVID. Prior to COVID, he was a typical, able-bodied, healthy child. Currently, he has unpredictable and severe headaches, cognitive fog, and fatigue that can be debilitating. These impact his ability to stay focused and complete multi-step tasks without some support. He was not that way before. Although these symptoms have improved over time, we have no idea what lies ahead for him. Similar to the chickenpox virus, the COVID virus can lay dormant in your system for unpredictable periods of time and then emerge unexpectedly, very much like what happens with shingles. 2 of my children received support through various means for ADHD and general anxiety disorder. One has a 504, the other does not currently have one, but will need one in the future. In the 2019-2020 school year, 14% of students, or about 7.3 million children between the ages of 3 and 21, received special education and related services under IDEA in public schools. Under IDEA, children with disabilities are guaranteed a free, appropriate public education in the least restrictive environment. Over 60% of students receiving IDEA services spend 80% or more of their time within their school in general education classrooms. Under Section 504, no otherwise qualified individual with a disability in the United States shall solely by reason of her or his disability be excluded from the participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. If school districts fail to mandate masking, immunocompromised students with disabilities will be excluded from participation in public education because of COVID-19 infection concerns. Under both the IDEA and Section 504, schools have a responsibility to provide a free, appropriate public education and to integrate students to the maximum extent possible. By not requiring masking, schools will have failed to meet the needs of qualified children with disabilities. If complete integration is not possible, then under IDEA, schools must provide a substantially equal education opportunity. Over the last 18 months, many schools have provided students with online or at-home learning. On Friday, August 20th, 2021, the Florida Board of Education approved the use of private school vouchers for children who chose not to wear a mask. However, online education and forcing children out of public school is neither appropriate nor equal. Additionally, many school districts may not have virtual programs available to students on a modified curriculum. The AAP expressed concerns for the mental health of children isolated during the COVID-19 pandemic. By not requiring universal masking, some parents will be forced to choose between a free public education and their child's safety. Children from underrepresented groups are disproportionately affected by the failure to mandate masks. More children from underrepresented racial and ethnic backgrounds are identified as having a disability than are children who are white, highlighting the racial and ethnic inequalities of the current policy concern. Children living in poverty are also more likely to have a disability than their peers are, highlighting the socioeconomic inequity of the current policy concerns as well. Some immunocompromised children may not receive special education and related services. In the 2019-2020 school year, about 1.909 million children ages 3 through 21 were identified as having an other health impairment, a federal eligibility category that includes chronic issues such as asthma, leukemia, and other immunocompromised conditions that put children at higher risk for developing COVID-19 complications. In 2020, 1,774 children under the age of 17 were organ transplant recipients. Studies have shown that transplant recipients do not develop the same level of antibodies from COVID-19 vaccination as do people who are not transplant recipients. These immunocompromised children may not fall under protections from the IDEA and Section 504, but schools are still required to reasonably accommodate them under the ADA. Failing to mandate masking is a violation of the ADA, the IDEA, and Section 504 of the Rehabilitation
That's time.
Act.
Thank you very much.
Thank you.
Mike Wentz, you'll be next in line.
Mr. President, before I step up there, I have
Yes, sir.
a point of order that I didn't get to ask. I've been vaccinated. I have
This is your public commentary. Come on up and speak. We'll be delighted to.
Let's do a point of order either. Okay.
You can come up and speak and tell us anything you want to tell us.
I'm asking a point of order. That's Robert's rules. You do remember Robert's rules, correct?
Sir, what is your point?
I'm not going to wear a mask. That's my point. Now, I'm going to try to be as constructive as possible. I've repeatedly said to this board, Title 33 doesn't give you the authority to mandate masks. And in addition, Title 122 has certain requirements that you still continue not to meet. And I asked a very simple question about your executive meeting. I'll get those answers later, I promise you. I want to read a letter that was sent to Governor DeWine by a Dr. Ryan Max, who's a licensed clinical psychologist, has his own group in Westchester, worked at Children's Hospital for 9 years, and the last 5 of which he served as the clinical director of psychology for the Division of Developmental and Behavioral Pediatrics. Imagine that. He wants to share with Governor DeWine the powerful mental health data from the CDC, as well as data from his own practice, where he sees over 5,000 patients per year. Now, why is mental health important? Well, let's read to you one of the candidates' campaign promises. My vision is to focus on important issues that impact Indian Hill students and families, including education, nutrition, mental health, drug prevention, drug awareness. According to the CDC's website, During the 2020 COVID pandemic, for all children under the age of 18, the United States averaged 1,673 hospital visits for severe mental health problems per every 100,000 youth. For 2019, the average was 1,161 per 100,000. Takeaway is the pandemic and its mitigation requirements resulted in a drastic increase in severe mental health problems. Now let's compare that to the most current COVID-19 hospitalization rates for youth in the United States. According to the CDC's COVID tracker, as of today, and that was August 16th, 2021, the current hospitalization rate for anyone under the age of 18 is 0.4 for 100,000. Think about that. Mental health, it's 1,673 per 100,000. COVID, with 3 months of Delta variant already built in, is 0.4 per 100,000. Data shows that a child is over 4,000 times more likely to go to the hospital for problems with mental health than for COVID-19. Sharing the same kind of data from his own psychology group, he shows that he used to get 30 calls a day, now he's getting 175. And the kids aren't just talking about their fear of COVID. A high percentage of them talk about problems related to masks and social distancing. What an anomaly, social distancing. I'm going to put this in the record because I have something else I guess I want to say, because it was written to our good friend Governor DeWine, you know, the one who was in Hamilton County last week without a mask, and that's also going to be part of the record. But I want to relate to other studies because, quite frankly, I get tired of cherry picking. I can cherry pick too, but there are studies on both sides of the issues. And the biggest part of the issue is, are we hurting these kids who are ages 0 to 19? Most high school kids are 18, but let's see 0 to 19. You know, you can tell me the rates are up dramatically. Yeah, if you go from 1 to 10, that's up dramatically. But that's 10, and I think the rates are now maybe 100. Let's be realistic, and let's not continue to punish our kids, because that's what you're doing. You're not concerned, for the most part, about mental health. I don't know what you're concerned about, to be perfectly honest. You know what? Here's what I'm going to do. I'm going to put all this in public record. You can read it if you want, or you can continue to ignore it. That's time.
Thank you.
Please state your name and where you live.
Sure. I am Dr. Amanda Holbrook. I live in Indian Hill, south Miami, so southern part of the district. I have 2 children. One is a 7th grader and one is a 2nd grader. So I am an adult internal medicine physician. I have formally practiced at TriHealth for a very long time. And actually part of my job, more applicable to this, up until about June, was taking frontline COVID. Part of my role was actually doing remote care, doing frontline COVID calls and first response for some of the probably the largest employers in our nation. So I was taking phone calls from some of our most vulnerable families and most vulnerable areas, all the way to other well-staffed areas, really seeing how the variances of community settings, economics, education, access, chance, everything impacted families. So certainly I could sit here and tell you a lot of very sad stories of entire families wiped out by COVID. You know, we are all here for the kids. I guess at the end of the day, I've got kids. My 7th grader, she hates wearing the mask. Come in here tonight. She's like, it's so uncomfortable, Mom. My kid has asthma. She's one of those vulnerable kids. We have a 504, right? That's not why I'm here today. Yes, I want to protect her. She's vaccinated. She's lucky. My 6-year-old has asthma. He can't be vaccinated. But I want to just respond while I have the time to a couple of pieces of information. I had to stand back for a second and say, why are we debating this? Masks stink. They're no fun. Nobody wants to wear them. I work in the hospital and I don't enjoy wearing all this stuff, but I do it because it's the right thing to do, because I'm protecting myself and someone else. We have to remember that. Why are we debating whether we put these on if our job is to protect the most vulnerable people, children? We're protecting children. You're debating whether to put a cosmetic thing on or not that actually has profound ability to decrease the spread of COVID in our community. And to answer your question, community just isn't your zip code. It really is all the surrounding zip codes and the area in general. If you look at Hamilton County, our rates right now are at high risk of vulnerability. To correct you on a few things you stated tonight, Superintendent Konecki, is the fact that a couple of things that is actually recommended that we do wear, all including vaccinated people, wear masks indoors, because we know people who are vaccinated, vaccines aren't 100%. You can still get COVID. It'll be a milder case, but you're going to share it with your neighbor, and you're probably going to share it before you ever knew you were sick. And so back to the most vulnerable, there are even people in the 7th grade and up that may not be able to get vaccinated. We have teachers, young teachers, they're going to be pregnant possibly. I could really tell you some very sad stories of vaccinated pregnant women who have profound complications that get COVID during pregnancy. We don't know yet a lot about COVID. It's still very young. And Delta's new. It's twice as infectious as what we saw last year. It's more easily spread to 1,000-fold, okay? So I just want to remember that. A couple other things. I guess the other thing, just when you look at all this data and you look at the up-to-date, I realize that like the American Academy of Pediatrics and, the Ohio Health Department and, the National Board of Pediatric Hospitals and all of those other boards aren't regulatory, but I'm going to guess when each one of you sick, have a family member that's sick, or you have children that you're figuring out how to keep them well, you go to clinicians who look to those organizations to make the best decision possible with the science that we have today to keep people well. And I have that updated. I did it tonight, and I'm happy to share that every single one of those organizations, based on the data we're seeing as of today, recommends indoor masking of everyone, including those that are vaccinated. Okay.
That's not time. I still have 45 seconds.
Okay, that was mine. So I just want to really remind you that when we make these social decisions on, I hate wearing masks, it's distracting, and all those other things, there's no, yes, it stinks, but there's no negative health impact from the mask. Mental health is going to be worse if half your family's is quarantined at home and you don't go to school. The studies show that social isolation and being at home give increased risks of everything from suicide to major depression, parents that can't work and make an income. We may have a very lofty idea of Indian Hill, but we have many families that cannot afford to miss work. So I would say, absolutely, we cannot change the mask rule. Cannot for under 12. And I really think you should hesitate on changing it.
Thank you very much. Again, as you come up, please state your name and your address.
Hi there. I'm Megan Seaman-Cosbeyer, and I live at 5800 Miami. I'm going to finish reading the ADA and IDEA information that some of my previous speakers were starting. So the additional considerations to masking. Many children reside in homes with immunocompromised parents, grandparents, or siblings. In 2012, 7 million grandparents reported living with at least one grandchild, and 2.7 million reported raising their grandchildren. 4% of these grandparents were over the age of 80. Additionally, many children have siblings who are immunocompromised. If the only option for in-person learning for these healthy children is to attend school with unmasked children, families may be forced to choose between sending their healthy children to school and risking their immunocompromised child's health, and keeping their healthy children at home to protect the health of their immunocompromised children. Universal masking in K-12 public school buildings has the potential to create an equitable, accessible learning environment for all children and their families. In summary, school mask mandates are essential to decrease the spread of COVID-19 in schools. Mask mandates help to protect children under 12 who are currently not able to receive the COVID-19 vaccine. Masking helps to protect immunocompromised children and their families. And that's the end of that. And then I have my own little intro. I already said my name. I'm here as a parent of 2 current Indian Hill students. My 11-year-old is too young to be vaccinated. My 15-year-old has had the Pfizer vaccine. Both are happy to mask because it means they and their friends can be back in school. And we all agree that kids being in school in person is paramount. I want to first say thank you to the board for following the science and for voting for universal K-12 masking. I am also here to urge you to continue upholding universal masking for all students, all people, for all indoor activities until at least 90 days after the COVID vaccine becomes available for all school-age children. With a novel virus like COVID-19, we are still learning important details 18 months into this pandemic, and I'm sure we'll be learning more day by day. We know that the current dominant strain, Delta, is significantly more transmissible than what we were dealing with last August. This suggests that we need more layers of protection, not less. It means we need better masks and proper mask wearing. It means that all indoor activities, including music and gym, should be masked. And it means more social distance, not less. Another important thing that we are learning is that long COVID occurs in more than 1/3 of children and adults, even after mild COVID infection. This is important, so let me repeat it. 1/3 have long COVID even after a mild infection. Section 504 now covers long COVID. In our district, how many more 504 plans will be needed for students who have long COVID if we decide to ditch the masks? I know a lot of COVID statistics are reduced to deaths from COVID, but what about impairment to everyday functioning by long COVID? Long COVID can impact both physical health and mental health. And continuing K-12 masking is an important layer of protection here. Please consider this information as you are making decisions on masking going forward. Thank you very much.
Thank you very much. Again, please state your name and your address as you come up. Thank you.
My name is Mike Wentz. I live at 8220 Shawnee Run Road. These microphones are great, aren't they? Yeah, it's too bad the kids don't have them in their classrooms. They got to go 7 hours every day without them. Anyway, at the last meeting, I spoke from personal experience about the negative effects of mask wearing, but I'm just a concerned dad. Jeff Heineken presented a letter to Governor DeWine from Dr. Ryan Max. I was going to do the same thing, and I will do the same thing in a little bit different format. But Dr. Max has experience with current and former Indian Hill students. He's not just some guy that's has a practice in Westchester. I'll read this verbatim, and I might summarize a little bit due to time constraints. My name is Dr. Ryan Max, and I'm a licensed clinical psychologist and founder of the Max Psychology Group in Westchester, Ohio, where we have 15 mental health providers, mostly psychologists, who specialize in child and adolescent services. Prior to private practice, I worked at Cincinnati Children's Hospital for 9 years, the last 5 of which I served as the clinical director of psychology for the Division of Developmental and Behavioral Pediatrics, which was the largest division at the hospital at that time. Over the last several months, I have listened to press conferences from you and your medical director and read published letters by groups of physicians asking for mask requirements to be levied on children due to concerns regarding COVID. What I have not heard throughout this entire public discussion has been data or general concern regarding the mental health of children. As such, I would like to share with you some of the powerful mental health data from the CDC, as well as the data from my own practice, where we see an average of 5,000 patient visits per year. According to the CDC's website, during the 2020 COVID pandemic, for all children under the age of 18, the United States averaged 1,673 hospital visits for severe mental health problems for every 100,000 youth. For 2019, that average was just 1,161. The takeaway is that the pandemic and its mitigation requirements resulted in a drastic increase in severe mental health problems for our children. That's not too hard to understand. Now let's compare those numbers to the most current COVID-19 hospitalization rates for youth in the United States. According to the CDC's COVID tracker, as of today, which was last week, the current hospitalization rate for under the age of 18 is 0.41 out of 100,000. For mental health, it's 1,673. For COVID, with 3 months of Delta variant under its belt, it's 0.41 per 100,000. This data shows that a child is over 4,000 times more likely to go to the hospital for problems such as self-harm, crippling anxiety, and suicide attempts rather than for COVID-19. 4,000 times more likely. Okay, so we're talking about risk here, right? We're all talking about risk. He goes on to talk about how his group has seen over a 400% increase in the last year for local kids requesting its services. He goes on to say, at this point, children are losing their childhoods, and with it, the quality of their education, social relationships, and mental health. Children, more than anyone, need stability and consistency. To have them go from a relatively carefree childhood to the COVID pandemic and mitigation measures to removing those mitigation measures this summer, only to re-implement them again now, will be absolutely catastrophic to their mental health. I'm not here to argue that mitigation policies are recommended by medical experts can help reduce COVID spread, but the medical risk to children from COVID is minuscule in comparison to the medical risk to children from mental health. And unlike a year ago, we now have mountains of data to see this. I'm very happy to speak to you, any of your staff, and anyone from the Ohio Department of Health should you have any questions. With regards, Ryan J. Max, PhD, licensed clinical psychologist. I just also like to say all this work you guys have done is amazing. Studying the charts, the graphs, all these things. But the damage that's done to our kids is not going to show up in a graph or a chart or some scientific study.
Thank you very much, sir. And please, you can give that to Jim. Is that it?
That is it for public participation.
Awesome. There being no further business, I would entertain a motion to adjourn.
So moved.
Second.
All those in favor?
Aye.
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 Thank you, everyone.
Exclusive coverage on the Indian Hill Television Network has been a copyrighted presentation of the Indian Hill High School Video Department. Exclusive coverage of tonight's game on the Indian Hill Television Network has been a copyrighted presentation of the Indian Hill High School Video Department.